Welcome to the next installment. We're going to talk about my favorite system, the digestive system. Now, it's my favorite because I know the most about it, because mine does not work the way that it should. So I like to think about how a digestive system should work. And this is the one that I know the most about. Okay, let's get started. So, let's talk. How long do you think this digestive system is? Well, it goes from mouth to anus and is about 30 feet in length, or 9 meters. That's quite far. Probably decent sized little boat, or maybe the width of a classroom. That's about that size, so longer than you thought maybe. Now, the digestive system, we have to remember, has both mechanical and chemical breakdown and digestion. So let's make sure we fully remember here. What is the point of having the digestive system? The point is that it is going to take in the food, break it down into the individual components that are needed to be absorbed, to be utilized by our body, and then eliminate the waste and the stuff that we don't actually need. Cool. We're going to figure out how it does it. So it all starts in the mouth. Now, if you have a look on the picture on the side here, you can see that there are a lot of parts to the digestive system. Don't worry, don't get overwhelmed. There are a lot, and they all do something very different, and they're all essential. And we're going to talk about each of them today. It'll be great. Don't worry. Hold on to your hats. Make sure that you're taking good notes. Oh, little aside, make sure your notes are dated and titled, and that you're drawing pictures. Hand-drawn pictures are better than copy and paste. You're taking your notes by hand, and you're ready to go for this. I know you are. Use everything we've put into practice, that we've learned so far. Put it into practice for what we're going to be doing. Okay, you got this. So question number 1. How long is the digestive system from the mouth to the anus? Let's talk about the oral cavity. Here we go. So the oral cavity itself, it starts with the lips. Now, these lips here close the oral cavity so that you don't accidentally let any dirt or bacteria or unwanted flies fly into your mouth, right? You want to keep it nice and closed until you put something in your mouth to eat. Your mouth also is liquidy. It's got saliva, it's got mucous membranes. And again, we want to keep them moist without them drying out. So if you're constantly breathing over your mouth, it dries out, right? And then you breathe in without any filter. So these lips help to seal it all off. We also have the buccals. These are the cheeks. And these also contain the oral cavity to ensure that when we put food into our mouth, it stays in and doesn't fall out the side. Pretty cool, right? We've talked at length before about our dentition. These are our teeth. Now, the dentition varies with the diet that we have. So I hope you remember what kind of diet we are. Yep, we're omnivores. Very good. Omnivores, we eat both plant and meat. So again, run your tongue around your teeth, and you'll feel the differences between your teeth shape. Flat, sharp, very flat for grinding. Okay, so our teeth are also very much involved. They're more involved in the mechanical breakdown, right? They're going to grind up the food to rip apart the large particles or the large food source and start to break it down into smaller pieces. Then we have the tongue. Now, this is the only muscle that we have that is only attached at one end, not at both, and it's incredibly strong. Our tongue itself is really pretty awesome. On the tongue are these papillae. These are the little taste buds, and remember that there are 5 tastes: salty, sweet, sour, bitter, and umami. Umami is the savory taste. Now, this tongue is not only involved in the sense of taste. What else is involved in taste? Your nose. Remember that we smell and taste to help us to actually get a full palate of what we're eating, right? But Our tongue is also very much involved in talking. I want you to pretend that you're going to do this with me, all right? So pretend that you don't have a tongue. And I want you to say, Sally spent $22, okay? And see what happens to your tongue. Sally spent $22. Very difficult, isn't it? I hope you tried that and you didn't let me do it and be silly on my own. Oh well, try it if you can. So Sally spent $22. And you'll notice that your tongue, do it with and without the tongue, your tongue's very important for talking. So are your teeth. Because if you didn't have your teeth, you wouldn't be able to say certain words. Your tongue is also very important for swallowing. So once we've chewed our food up and we're ready to swallow, the tongue gives a little kick at the back, an undulation, and it kicks it to the back of the throat so that we can then swallow it. So thank you, tongue. Very important. I actually went to a American Cancer Society talk, and there was a gentleman there who had had his tongue cut out because he had got tongue cancer from smoking. And it was the worst and the most amazing speech I've ever heard in my life. I will never forget this. You could hear a pin drop, and there were probably 5,000 people in this room. And this man came up and he started talking, and it took him, I don't know, he gave a 40-minute speech. And at first it was really difficult to understand what he was saying, and then after a while your brain just clicks on to what they're saying or what he was saying without a tongue. And unreal, absolutely unreal. So unfortunately the man couldn't actually eat anymore, and he was constantly like drooling, and he had issues with that because he didn't have a tongue in order to swallow properly. It was really, really interesting. Anyway, I digress. So not only do we need our tongue for taste, for swallowing, and for talking, but we also need it to help with the movement of the food around the mouth for equal distribution for wear and tear. So remember I told you about Sarah, my niece, who had the brain tumor, and she can't feel on one side of her body. She pushes all the food to one side that she can taste and feel. And so what do you think's happened to her teeth? The side that's not being used are actually slightly longer than the side that are being used. Whoa, because our tongue is allowing for equal distribution and wear and tear on our teeth and our mouth by pushing the food to be equally chewed around the mouth. How cool. All right, I want you to stick your tongue to the roof of your mouth behind your front teeth, and I want you to drag it towards the back. Don't go too far, otherwise it might tickle or it might make you gag. But I want you to do it slowly so you can feel the difference. At the very front part behind your front two teeth, you'll feel that it is hard and it's wrinkly and bumpy. That is the hard palate. And then when it goes back and then it goes glunk, it gets soft. And thankfully they called it the soft palate. Not some weird words. They used hard palate and soft palate. Now the palates are very important. They are going to separate the oral cavity from the nasal cavity. You don't want to be eating and then all of a sudden spaghetti comes out your nose. That would be very unpleasant. And if anybody's ever laughed so hard that food or liquid comes out your nose, you know it's an unpleasant experience. So thankfully, this palate helps to separate the nasal from the oral cavity. It is also there for speech, and it helps with the formation of words. And it helps with the formation of a food bolus. Now, I will explain that term in a moment. Ooh, little dangly carrot there. Here we go. Now, let's make sure that we understand. Here is a little picture, okay? So look at the top picture. You can see that there are 3 pairs of salivary glands. The salivary glands, you have them in the cheek up here, under the tongue and under the jaw. And they are there for 2 main purposes. In saliva, there is mucin. This is a lubricating protein that holds everything together. And there is amylase. Amylase is an enzyme that's used to break down starch. Now, you need to have spit in order to help form this food bolus, which I'll come back to in a second. You also need spit in order to start breaking down and having the first portion of chemical breakdown in your mouth. So there are some ninny poos that have done a saltine cracker challenge, and I'm going to call them ninny poos because it can be dangerous because you could inhale the crumbs. So I do not endorse this. In fact, I tell you, don't do it. Just look it up on YouTube on the last ninny poo that did it, and you can see how if you eat a saltine cracker, it's going to start to dry out your mouth, and after a couple of crackers, you can't chew and make it into what you need to make it into because you've run out of spit. And so you got all of these crumbs and fluff, and that's when you could really choke. So don't do it. But if you want to watch somebody else on YouTube do it, you can then see how important saliva actually is. Now, that's the chemical breakdown coming from the salivary glands. But the mechanical is going to come from the movement of our teeth and our tongue. And the movement of the teeth occurs from our lower jaw, that's the mandible, moving against the top jaw, which is fixed, which is the maxillae. The maxillae is fused to the rest of the skull, but it is only this mandible, this lower jaw, that actually moves and allows for the teeth and the jaw to grind and move the teeth against the teeth to grind up the food. Now, have you ever seen in the back of your throat that there is a little dangly punching bag? Thank you, SpongeBob. Yes, the little dangly thing in the back wearing cartoons. They are, and you see it wiggly wiggly. Okay, this is the uvula. Now, the uvula, great Scrabble word, the uvula, its job is to act as a directional flow to move the food down the pharynx. Remember, the pharynx is the back of the throat. We've talked about this before. The pharynx is the back of the throat where it decides whether or not it's going to go down the esophagus, which is the food tube, or the trachea, which is the windpipe or the air tube, which sits in front, right? But this uvula is going to make sure that it goes down and not up and out your nose again. If you're laughing so hard that your uvula fails, you might get chocolate milk come out your nose or Sprite, and that's not going to be very pleasant. So the uvula helps with making sure that it goes down, not up and out your nose. The second thing that the uvula is for is that it is going to act as a gag reflex. So if you're chewing your food and you haven't chewed it well enough and all of a sudden it hits the back of the uvula, you'll have a gag reflex and it says, you didn't chew it enough. Put it back in your mouth in order for you to chew it properly. So as I said, the pharynx is the part of the back of the throat where it decides whether or not it's going to go down the esophagus or the trachea. And remember that we had that epiglottis that we talked about that covers up the trachea when we swallow so that we don't inhale our food down the wrong tube. Okay, now I need to tell you about a food bolus. I have mentioned it a couple of times, and I do hope that, I had to get rid of SpongeBob. I do hope that you wrote it down with a little star by it saying, okay, I need to make sure that I get the definition for it, because you don't want to write words down you don't know the definition for. Okay, so now we're going to explain what a food bolus is. A food bolus is your chewed up food that is ready to be swallowed, and it is either spherical or egg-shaped, like the images down below. This is fully chewed up food ready to be swallowed. It has been mixed in with the saliva, and you've had both mechanical and chemical digestion going on in the oral cavity. Now, there is a very special word for this, and I'm going to tell you, be careful how you say it. One slipped up letter, and you could be rather embarrassed. So, are you ready for the word? It is mastication. Okay, mastication. This is the act of mechanical and chemical breakdown in the mouth. So it's the chewing, the grinding of the teeth, the mandible against the maxillae, the movement of it around with the tongue, and the hitting against the palates, at the same time as the mixing in with the saliva in order to form this food bolus. Okay. So a number of people are like, well, how much should you chew? And I will tell you that years ago, my grandmother used to tell me, oh, you got to chew your food 20 to 40 times. If you chew it this is the amount that you should chew it. And if you chew it too much, it's very bad. And if you don't chew it enough, it's very bad. And in fact, at the time, I thought she was a little bit doolally, but she wasn't. She was right. In fact, let's say for a piece of meat, if you're chewing it, there is an optimal amount of times you should chew it. It should be at 32. Isn't that weird? Somebody's come up with an optimal amount. Why? Because this is the mechanical and chemical breakdown to allow you to get enough of the ripping and shredding occurring with your teeth and the mixing in with the saliva. Now, what happens if you chewing a piece of meat and you've been like 45, 50 chews on this one piece of meat, yum, 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 and you're still chewing it and it's still not ready to be swallowed? I'm sure you've had one of these before where it's not chewing up. Well, there's two things that could be. One, you bit off more than you could chew. That's a nice phrase. And it means that you literally have bitten off more than can be chewed appropriately, and it's no longer able to be chewed up properly. So smaller bites. The second is that meat is bad quality and you don't want to be swallowing it. So if it hasn't been masticated efficiently within, say, 30 chews, it's time to spit it out politely into a napkin, because that's not going to get digested properly, and it's just going to pass the problem along down the line. So don't have that. But what happens if you like eating ice cream? Should you be eating that and chewing that 32 times? No. Or soft broccoli? No. You're going to chew your food until it forms a lovely, well-formed food bolus that you can easily swallow, and it's well-formed, well-shaped. Okay, which brings me to my extra credit. No, I'm not crazy when I say this. You are going to get an extra credit point. If you are going to go and take a piece of bread or any bread-like structure, a bagel or whatever, it does not have to have cream cheese and smoked salmon on the top, just a plain piece of bread, okay? And what I want you to do is take a bite, a normal-sized bite, and chew it. And just before you're about to swallow that food bolus, I want you to spit it out and have a look at it. Is it well-formed? Does it look slimy and gloopy so it could be easily sliding down the esophagus? Yeah, cool, you've done very well. If not, maybe you need to chew better. Now, how am I going to tell? You are going to take a picture of it and upload it to your assignment. Yes, I know, it's weird. And I will judge you on your food bolus, making sure that you have chewed, masticated your food properly. Ooh, okay. So as I said, we are going to be talking about anatomy and physiology, so structure and function, and ailments. So the first ailment in the oral cavity are going to be your teeth. You do not want a cavity, right? Why not? Because they can actually lead to your tooth breaking down, causing pain. It can cause issues with your teeth, and we need our teeth in order to masticate, okay? What can increase the risk of having cavities? Well, eating sugary food, lots of bacteria on your teeth, and that sugar wants to keep eating away and feeding at those teeth because those bacteria are fed by the sugar. If you drink lots of soda that's got lots of acid in it, that can break down the enamel. Let's see what else. If you're not going and getting regular hygiene and cleaning of your teeth, not only can that be problematic for your teeth and your gums and your mouth, but it can also lead to heart issues. So really important you go and see the dentist twice a year for your cleanings and for your dental health checkup, and making sure that your teeth are nice and clean to help with your overall body. Another condition that I want to draw your attention to is a cleft palate. Remember how I said in the beginning that you're a baby and you grow and develop from a sperm and egg, boop, join together, form a zygote, these grow, blah, 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 and then they join in the middle. Well, some of us don't always join in the middle. I didn't join in the middle in my belly. My second cousin didn't join properly in his heart and belly. And my aunt didn't join properly in her cleft palate, and so she had a cleft palate. It didn't join properly, and so she had to have surgery, a couple of surgeries actually, in order to fuse it back together again. So that she's got a little tiny line, you can hardly see it, but a little tiny line across her lip where they refused it back together and sutured it up. Unfortunately, there is a lot of babies that are born in third world countries that have this, and there is, I think it's called Operation Smiles, is a non-profit organization that sends doctors out to do these surgeries to fix these babies for free, which is amazing, and they provide all of that for free. If it isn't fixed, it can lead to swallowing issues, and it can lead to malnutrition and non-development, all sorts of problems. So it needs to be fixed. And again, this is a neurogenical defect as the baby is growing and developing in the womb. Okay. Salivary stones. Did you know that you could get stones in your salivary glands? Yeah, they're really painful. So do you know how you get rid of them? You suck a lemon. Why? Because sucking the lemon actually produces more spit, and you're more likely to flush them out. But again, you could probably seek treatment if you're getting these stones out. They will be rather painful. Last one for the oral cavity as an ailment. Remember, an ailment is anything that doesn't make you feel 100%. And so this one is going to be halitosis. Halitosis, this is basically bad breath. And halitosis can come from certain products like onions or smoking, or you might even have issues with kidney disease or liver disease that can affect it. Decomposing gums and teeth, alcohol, and halitosis could be from a number of reasons. They could be just what you're consuming, but they could be underlying conditions. So if you really have bad breath, speak to a doctor about it. Question number 2. What word means mechanical and chemical digestion in the oral cavity? Good luck spelling that one correctly. Okay, next. Let's talk about the throat. We remember that on the throat, we've already talked about, if you put a hand here and go, we talked about the larynx, which is the voice box, and the trachea with the rings of cartilage. And we said that right behind it, we have the esophagus, okay? And we also talked about that epiglottis that covered up the trachea, the one that's in front, to prevent the food or water from going down so we don't aspirate. Aspirate means to inhale into your lungs something that is not air, right? That shouldn't be there. And we talked at great lengths about the Heimlich maneuver and how to help people of different sizes and ages and pregnancy and yourself, okay? So make sure you remember all of that. You never know when it's going to come in handy. All right, here we go. So let's talk about the esophagus. The esophagus itself is about 10 inches or 25 centimeters long. And what's really amazing about it is the way that it gets the food from your mouth to your tum-tum. Now, you could actually eat in zero gravity in space, so it's not gravity. And yes, some people have eaten upside down to prove this. I do not endorse you doing that. Dangerous. But it is possible to, because it is not gravity that moves the food bolus down, but rather it is peristalsis. Now, I'll give you a hint. Peristalsis is one of my favorite words. I have quite a few favorite words, don't I? But peristalsis is one of my favorite words. I don't know why. I just like it. Okay, peristalsis. These are rhythmic contractions, and it squidges the food bolus along down the length. You can see how we are going to yum, 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 chew and follow it along, A, B, C, D, E, so on and forth, right? You can see we're chewing. The tongue gives it a little kick. It pushes it to the back of the pharynx and it goes down the epiglottis closes off and it goes down the esophagus. And now we've got these peristaltic waves that push the food down the esophagus and plop into the stomach. Now, how do we make sure that the content stays in the stomach and doesn't come back up the throat? And how do we make sure that what we're eating at the top doesn't, just fall down? It's because of sphincters. A sphincter, if you remember, we talked about this in the urinary system at the bottom of the bladder. A sphincter is a band of muscles that runs perpendicular to the length of the tube. So it closes the tube off. A very good example of a sphincter that you're probably familiar with is your anus, right? That's actually a double sphincter. But inside your throat, there are two sphincters. There is one at the top that actually is responsible for moving the epiglottis, and there is one at the bottom that attaches to the stomach. Okay, let's talk about hiatal hernias, because it kind of has to do a little bit with these sphincters, or at least the location of them. So, a hiatal hernia is going to be whereby the top of the stomach squidges up through the diaphragm. Ruh-roh. This can actually be just a small amount, or actually quite a lot of the stomach can go through a little hole and go up into the thoracic cavity. That's going to cause issues with your breathing. That's going to cause issues with food being swallowed. It can cause all sorts of issues. So they can try and fix it with medication, with maneuvering. But if that doesn't work, you might need surgery in order to fix it. This is whereby they might actually just go in and make the diaphragm hole smaller. They pull it down and make the diaphragm hole smaller, and so that the stomach doesn't want to move back up through. But most typically, they're going to do something called a Nissen fundoplication. Now, my mother and I both have a Nissen fundoplication. Mine was because of a hiatal hernia, and hers was trying to fix another situation. But in fact, for both of us, it's actually made it worse. And I will tell you why in a second. So the Nissen fundoplication, they're going to take the top part of the stomach, wrap it around the esophagus, and suture it to itself, so that this extra bit can't move up through the diaphragm. It's kind of trapped and stuck where it is, and it no longer pushes up through the diaphragm. I have to say that it did help my asthma. I had much worse asthma than I do now, and that the Nissen fundoplication, because I had a hiatal hernia and my stomach was pushing through and irritating my lungs, it was definitely helped fix that. But when you have a Nissen fundoplication, you can no longer vomit. You might be like, wow, that would be nice. It's not. It's horrible, and I'll tell more about vomiting in a minute. But it also, because of the location of where this Nissen fundoplication is, there is a big nerve branch that runs right behind it. It is called the vagus nerve, and this vagus nerve is super, super, super important for so many things, from digestion to balance to breathing to your bowels to all sorts of things, right? And the Nissen fundoplication is now renowned for causing damage to that nerve. So they're a little more hesitant about doing a Nissen fundoplication. They don't do them just as they used to, because they're now finding that there are long-term problems to having a Nissen. Although, yes, they fixed my hiatal hernia, they've actually caused a whole series of other issues for me personally and for my mum from doing this. So again, with medicine, you kind of have to weigh up, is this actually a really beneficial thing? Is this going to be something that has to be done? Or is it going to help now but cause issues long term down the road? Okay. On to the stomach. Now, the stomach is a really cool little J-shaped pouch, and it is little. It's about the size of your fist, but it can expand to hold approximately 1 quart of food. That can expand quite big. Again, that lower esophageal sphincter is that muscle that is going to close off between the esophagus and the stomach, so that as the food gets into the stomach, it doesn't go back up. Well, that's the plan at least. Unfortunately, sometimes that lower esophageal sphincter can become leaky. This could be because you had too much food, or because of pregnancy, obesity, for a whole host of other reasons. And that lower esophageal sphincter can become leaky. And so the contents can bubble up through into the esophagus. Now, the contents of the stomach is very acidic. And so that might be why you think that your heart is on fire and you're getting heartburn. It's because this acid is bubbling up and causing erosion and irritation to your esophagus. So there are people that have called an ambulance because they thought that they were having a heart attack because they were just like so much pain in this region. So they went to the hospital and they ran EKGs and they ran to look to see what was going on in the heart. And they came back and they said, your heart's fine. And you're like, well, it still hurts. And I'm having a heart attack. And they're like, well, no, you're not. What did you do when you called? Well, I was at the diner. Oh, yeah. And what did you eat? Well, I didn't have much. I just had, a cheeseburger and fries and chili cheese dog and a milkshake and I had a Black Forest gatto for dessert. Ha ha! You ate too much. You ate too much of the wrong stuff and you caused yourself heartburn. And this little cost is going to cost you thousands of dollars. Youch. Right? And really all they're going to give you is some Pepto-Bismol or some Tums, Malox or something to neutralize the acid and to calm it down. Well, unfortunately, in some cases, this heartburn is a chronic condition. Chronic means long-term. Acute means short-lived. So if you've just got one bout of heartburn, let's say you ate something that was really spicy or you ate a very large meal, you might take some Tums and that's short, acute, over and done with. But chronic, meaning that this happens often, time and time again, they might prescribe for you some medications that reduce your acid production so that it's not as acidic. And so less likely to bubble up through. So again, with gastroesophageal reflux disorder or disease, this is whereby your sphincter is leaky and that it is going to allow for the contents of the stomach to bubble up. You can see in this picture of pregnancy why a lot of women actually get a lot of acid reflux, because the baby is pushing up and the shape of the stomach gets squished and opens up that sphincter. And so a lot of women, typically in their 3rd trimester, when they're really big and heavy, will carry Tums with them in their pocketbooks and their purses, because they're probably going to have this acid reflux. Reflux means the regurgitation is moving back up. Or obesity, eating lots of foods, fatty foods, fried foods, alcohol, that can also cause issues, or eating late at night and going to bed. Medications can also cause this, so be careful. All right. I said I was going to talk about vomiting. Now, vomiting is actually a very, very important thing. Why do we need to vomit? Well, it's basically in case you get something bad into your body and you need to get rid of it. You need to expel it. So that stomach is going to contract. And it has to have enough force to A, go against gravity, and B, to go against 2 sphincters. So it has to contract enough to push with high velocity out of the lower esophageal sphincter, up the length of the esophagus, through the upper esophageal sphincter, and then out of the mouth to get rid of it. So this vomiting process is really important. What would happen if you had a bad shrimp and you got food poisoning? Well, you would want to get rid of it. So your body secretes lots of acids, lots of liquids and causes this nauseation and this vomiting to expel it before that bacteria really gets too much for your body to deal with. And so it's a safety mechanism, vomiting, very important. So without that, what do you think has to happen? Well, it has to travel through your body, and your body has to deal with the consequences of having too much bacteria and badness and toxins in your body. And so it can take longer to recover from if you can't vomit. So vomiting is good as a safety mechanism. All right. The fundus. The fundus is the top curve, and we're going to talk about the fundus of the uterus, the fundus of the belly of a pregnant person, and the fundus of the stomach. It basically is the top curvature, right? That's what it is. Now, when you swallow air, it gets trapped into your tum-tum, into your stomach, and sometimes this gas gets passed along if it's small, but sometimes it accumulates, and it accumulates in the top part of the stomach. And you'll notice how the sphincter is lower than the top of the stomach. So the gas gets caught there, and once it's had enough pressure and enough buildup, it can squeeze, boop, and the gas comes out the sphincter, and off it goes. You have a little burp. Notice the shape of it. When we talk about the stomach, we talk about a J-shaped curve, and that the outer portion has got a greater curvature than the inner portion, hence it's called the greater and lesser curvature. Just structurally kind of cool. Let's keep going. So if I were to cut a stomach inside and look inside, you can see that there are wrinkles. These are the rugae. They are there for both mechanical and chemical digestion. Mechanical, the stomach itself is really muscular. You can see in the graphic below that it is very muscular and it likes to move around. The rugae are there to help to grip and grind on the food bolus that's been swallowed down into the stomach and continue the mechanical breakup of it. But it also allows for the secretion of enzymes like pepsin and acids like hydrochloric acid. Hydrochloric acid is the acid that is secreted by the stomach is quite strong. It's about 3 molar. So if you've done any chemistry, you'll know that 3 molar hydrochloric acid is nothing to be sneezed at. It is pretty strong. You don't want to get it on yourself, let's put it that way, which is why if you vomit and you're vomiting up the contents, it can burn your throat and it can burn your mouth, and it can cause erosion issues with your teeth, and so this because it's very acidic. Now, the last thing I wanted to mention about the rugae is that they are wrinkles that can expand and stretch out to allow for contents to expand your stomach, which is a good thing if you're eating more than just a little snack, right? So you can have expansion in your tum-tum. All right, so the food is going in. It is being broken down mechanically and chemically until it forms into ding-a-ling-a-ling-ling chyme. Now this chyme is what I call food gloop, and this food gloop is the food bolus that has been broken down into a liquid gloop and ready to pass on. Well, how do we know it doesn't just pass on automatically? That is because there is another sphincter that is at the bottom of the stomach, and it is called the pyloric sphincter, and it keeps the stomach contents closed off so that it has plenty of time to do the mechanical and chemical digestion of the food before it goes, yep, it's chyme, open up, and it passes the chyme into the small intestine. Okay, let's talk about a situation in an ailment in your stomach, and it is more prevalent than you think about. Ulcers, okay? Ulcers are basically erosions, eaten away lining of your stomach by predominantly it's going to be caused by a bacteria. It is a nasty bacteria called Helicobacter pylori or H. pylori, and it eats away and erodes at the lining of your stomach. It could also happen from taking NSAIDs, which are non-steroidal anti-inflammatory drugs like ibuprofen or even aspirin. It can irritate the lining of the stomach. Okay, so we've eaten away at the lining of the stomach, and now this bacteria gets in there and causes a little pus-filled thing, and then more acid gets in there, and you can see how it's going to hurt. It's not meant to have acid deep down in the layers of your stomach. Now, we do replace our stomach lining really quite often. We're continuously replacing that stomach lining. In fact, some of your intestine replaces itself every 2 to 3 hours. Your stomach's slightly less than that, but it's still rapid regeneration, and it's moving the cells from the back towards the front, just like shark teeth, right? Now, it can take a little while for that to occur and to create an ulcer, but what's going to happen is it's going to bury down through the layers of your stomach, eating and eroding away, and it could cause bleeding, it can cause pain, it can cause problems. So what do most people do when they have this? They take medication, they self-medicate, and they will take antacids like Tums, Pepto-Bismol, Maalox, whatever it might be, and their tummy goes, because it's neutralized the acid, and the acid's no longer eating away further into that ulcer. But does it fix it? No. It's like putting a Band-Aid on a broken leg. It isn't going to do anything but make you feel a little better. So, how do you know what's your ulcer? Well, they can do imaging. They can go down and do an endoscopy, and they can get images like that little orangey one, and you can see the white part. That's an ulcer on the stomach lining. Or they can do a stool sample test. So you poop and you send off a sample of your poop to your Quest or LabCorp, and they are going to look to see if it contains Helicobacter pylori. And if it does, they're going to give you antibiotics, and it's going to clear it up. Now, the Maalox and Tums and antacid industry does not want me to tell you this, because they like providing you the Band-Aids for your broken leg, because that keeps them in business. Multi-billion dollar industry, which could easily be fixed by a free course of antibiotics at Publix. And maybe a change in diet, and maybe a little reduction in your acid for saying taking omeprazole or the little purple pill, Prilosec, OTC, right? Okay. Now, you know, if you know me, you'll know that I hate gum. I hate it with a passion. I hate the smell of it. I hate the look of it. You look like a cow chewing on the cud. In fact, Mrs. Benjamin hated it as well. And that's why it's banned at the school, is because she thought it was uncouth and not good as well. But I go one step further, and I think that it is actually unhealthy for you. And you might be like, well, I've been told that it's good in case I can't brush my teeth. Bring a toothbrush with you. Brush your teeth. Rinse your mouth out if you're concerned about that. But if chewing gum is to help you to create saliva, to help you break down the food in your teeth, no, right? Significantly better other things you can do than chewing gum. Because what does gum contain? Well, if you're chewing bubble gum, it contains a whole lot of sugar, and that sugar goes directly on your teeth and causes cavities. Oh, but it's sugar-free gum. Oh, yes, you've got aspartame in there. Oh, two things about that. Number one is that it is a known cancer-causing agent, and number two, eating too much aspartame is going to cause you diarrhea. Enjoy that. So, not good. But if you are chewing, yum, 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 it stimulates your salivary glands to produce saliva, which you swallow. And that goes into your stomach, and your stomach receives the saliva and goes, ooh, we're getting food. And so it starts to generate this hydrochloric acid and the pepsin, and it's like, okay, send it down. I'm ready for it. And nothing's arriving. And so there's still more saliva, and there's still more acid production, and there's still no food. So you got all this acid in your stomach. What's going to happen? Well, it's got to digest something. What's it digesting? Yeah, you got it. It's digesting you, which increases your risk of ulcers. So I say ban the gum. No gum. Gross. All right, let's move on. Let's talk about the small intestine. Now, it's not small based upon length because it actually is 2/3 of the entire digestive tract is condensed into the small intestine. So about 20 feet or 6 meters. That's long, right? But it's small because of the diameter. It's very thin and it's small. It's only about 1 inch, which is about the width of my thumb knuckle, right? It's very small in diameter and very thin-walled as well. So that's why it's called the small intestine. There are 3 parts to the small intestine. Do you remember I said that a lot of things come in 3s? Yep. We're going to see it again today. There are a lot of things about 3s. So we have the duodenum or duodenum. I forget which is American and which is English. I give you both so you're now bilingual. You're welcome. The duodenum, duodenum. You also have the jejunum and the ileum. That's in the correct order going from the start to the end. So the ileum connects to the large intestine. The jejunum's in the middle and the duodenum is at the start coming off of the stomach. Now, here is a question for you. Question number 3. What part of the stomach can expand to allow for more food consumption and simultaneously increase mechanical and chemical digestion? Do you remember? Let's continue talking about our duodenum. Okay, and of course that answer was the rouge. Here we go. So the duodenum. The duodenum or duodenum, this is very important for a number of reasons. The first thing that it does is it neutralizes the acidic chyme. So the stomach has created the acid. Oh, why does it make up the acid? This was an important point that I forgot to tell you. Why does it make acid? Well, it makes acid to denature all of the bacteria that we're eating. It also helps to start breaking down the food sources that we want to start chopping up. But that acid is there to help as a protective mechanism to denature all of the bacteria and whatever else that we're eating and to try and kill it off before it gets into us and causes issues. But we don't want to denature the rest of us, right? We don't want that acidic stuff, the chyme, to get into our small intestine because it could erode away at the lining, causing ulcers, causing irritation, inflammation, and that's a big no. We don't want that. So the duodenum's first job is going to be to secrete a bicarbonate, a mucus that is going to neutralize this acid. We are then going to have it so that the chyme is no longer going to denature our intestine. Yay. Now, the second big thing you need to know about the duodenum is that it is the site of the greatest amount of chemical breakdown because there are 3 accessory organs that dump their digestive juices into the duodenum via something called the common bile duct. Now, when I say duct, I don't mean quack, quack. A duct, D-U-C-T, and making sure that you spell it correctly and you're not going to be putting birds throughout your notes. Okay, so there are 3 accessory organs. We have the liver, we have the gallbladder, and we have the pancreas. And they are super important, so we're going to talk about each of those individually now. So your liver has over 500 functions, but don't worry, I'm not going to ask you to remember all 500. We're only going to talk about 3. Why 3? Because 3 is the magic number. Okay, so the first one that the liver does is that it produces bile. Now, bile is an enzyme that is used to break down fat or lipids, right? So this is going to be an enzyme that is produced by the liver to help with the breakdown of the lipids or fat that we ingest. Very important. The second thing that the liver doing that I want you to remember is it detoxifies. So if you are drinking alcohol when you're of age, or hopefully later, you just sip a champagne at a wedding when you're 30, right? That little sip of champagne is going to be alcohol broken down by your liver, which is that's its job, is to detoxify. So any of the herbal remedies, any certain medications, your liver is going to break it down and metabolize those chemicals or the products that you're putting into your body. And that's its job, is to break down and make it so it is not toxic. Cool. Thanks, liver. Pat my liver. Okay, the third thing, so remember over 500 functions, but I only want to remember 3: bile, detoxify, and storage. It's an amazing storage site. It stores all sorts of things in there, and that's all I want you to remember. Okay, your liver is really pretty cool. Okay, your liver can regenerate. In fact, it can regrow back its cells. So it's really clever in the fact that it can take some abuse and it can regrow, but to a certain extent. You don't want to abuse it too much, otherwise it waves its little white flag and it's like, I give up, I'm not doing this anymore, and it can't regenerate and keep up. This happens a lot if you abuse it with, say, alcohol or drugs or excessive prescription medications. These can come in and hurt the liver, and the detoxification process takes a toll on it, and it can no longer function. Ruh-roh. And you can't live without your liver. Now, there are 2 lobes of your liver. There's the big one and then the small one, which you can see in this picture below. The little part, the small lobe, it can actually be donated by a living donor. So if you know that your friend or relative that you are type and cross matched, a match for, so you've got blood type and all of your antigens are all kind of like matching, you can actually donate this frontal lobe to your friend or relative, and they will receive that lobe, and that little lobe will actually grow into a much larger liver and will take over from the liver that's no longer functioning for them. Now, your liver is really cool. As I said, it's regenerative. It can grow back part of, or nearly all of it, of that frontal lobe, that little lobe, and it will grow back to being a fully functioning normal liver. No, you cannot do it again. I know there's some of you out there that are like, oh, I could grow my liver, donate it, grow it, and donate it. Nope, only the one time. But you can be an altruistic donor. There are 2 things that you could donate. You could donate your liver or one of your kidneys, and you can donate them without ever knowing the person, and you'd be like, you know what, I'm a healthy individual, I'd be happy to donate part of mine so that my body, so that somebody else can live. And there's an altruistic donation. Pretty impressive. Anyways, so it can be done with your liver and or your kidney. Your liver itself, when it is whole, weighs about 3 pounds. What else weighed about 3 pounds? Yes, you're right. It was your brain. Okay. And so we're now producing the bile. The bile now needs to go down a tube, and it goes down the common to the common bile duct, which dumps into the duodenum via the hepatic duct. So bile produced in the liver goes down the hepatic duct into the common bile duct and helps to break down the fat. Now, some of it is going to get a little siphoned off to the gallbladder, but we'll talk about that later. But for now, I want you to notice I use the word hepatic. Hepa is the prefix that means liver, and that's going to be an important thing. Have you ever heard of an air conditioning filter called a HEPA filter? HEPA means superfiltration, right? That's pretty cool. HEPA, liver. So this is why you might get hepatitis. Oh, HEPA, the prefix means liver, and itis means inflammation of, and this is typically due to bacterial or viral issues. So here we've got viral hepatitis. There are A, B, C, D, and E strains of hepatitis, and hepatitis affects only your liver. There are vaccinations for a couple of them, but you you are basically just going to see that a lot of the hepatitis virus is transferred through bodily fluids. So practicing safe sex, don't share needles, obviously don't use needles or need needles, don't drink water that had, or eat food that has been contaminated with feces, poop, and again, just be careful of blood and blood products, because again, it could contain hepatitis. So there are some vaccines, but not all are vaccinated, and this is going to be a terrible, terrible virus, and it is going to affect your liver, and you can see how it can actually cause you to have death or a significantly shortened life, and you can get cirrhosis of the liver, which is also not only caused by things like hepatitis, but cirrhosis of the liver can also be caused by excessive alcohol consumption, smoking, doing drugs, doing things that your liver is like, you know what, I'm trying to get rid of this toxins here. Give me a break. Stop giving me too much. And you could be getting this, and it could be pickling your liver and causing you to get scarring. And when your liver gets to this stage, you are no longer going to have a functioning liver, which could lead to being jaundiced. Yes, you go yellow. This is not photoshopped. This poor gentleman here had jaundice, and his liver stopped functioning, and there is a buildup of toxins and blood products that get into your skin. Now, some of you might have been like, well, I was jaundiced as a baby, or I have a friend or a sibling or somebody who was jaundiced as a baby. Well, sometimes your liver takes a few moments to decide to function, because when the baby is in the uterus of the mother and growing, developing inside the mother does all the work for the baby. And once the baby's born, the baby's got to work out how to breathe on its own, how to eat, how to process the foods, and how this liver is going to work. And sometimes the liver takes a moment to be like, whoa, that's a lot going on. What am I meant to do? And it's a little bit slow to the game. So once it then comes up to fix and start working, then it's a-okay and the liver's great. In the meantime, they put the babies under a UV light, a special light, and that helps to break down the accumulation of the bilirubin, which is a byproduct from the blood that is usually fixed by these livers, but is being slow to deal, and that's why the babies look a little yellow. But it's usually, majority of the time, easily fixed by UV lights. Kind of cool. Now, who would you see if you had an issue with your liver? You would see a hepatologist. Hepa, remember, that's the prefix that means liver, or a gastroenterologist, or a transplant hepatologist, because they're going to deal with transplanting a liver. How cool is that? Question number 4. Put the 3 parts of the small intestine in the correct order. I wonder if you can. I know you can. You got this. Obviously, that was the duodenum, the jejunum, and then the ileum. All right, so we said that there are 3 accessory organs. They are the liver, the gallbladder, and the pancreas. We've talked about the liver. Now we're going to talk about the gallbladder. Now, the gallbladder is a very cute little sac that sits under your liver, and it's green. And its job is to store and concentrate the bile. Now, I did tell you that down the hepatic duct coming off the liver, some of the bile, this enzyme that breaks down fat, gets going down the hepatic duct to the common bile duct and goes straight into the duodenum. But some of it gets redirected into this gallbladder. And it is going to take that bile and concentrate it up and make it more potent, stronger, right? More concentrated. So that when you eat something very fatty, the little gallbladder is going to go squeeze and shoot out this concentrated bile so it can break down this extra fatty stuff. So, for example, if for lunch you decide that you're going to have a salad with a little bit of cheese or feta cheese on it, unlikely that you're going to need to engage your gallbladder. But if you have a bacon double cheeseburger with French fries and a milkshake, hello gallbladder, you are going to be used. Now, unfortunately, sometimes these gallbladders can be a little finicky and they don't like what you eat. And sometimes they can create stones. This is called cholelithiasis. Wow, isn't that a crazy word? Okay. And this basically means your gallbladder is going to make stones. Now, these stones are going to be typically cholesterol or bilirubin, and they are going to fill up your little gallbladder, and they are going to cause it to become inflamed. An inflamed gallbladder is called cholecystitis, right? This is an inflammation of the gallbladder, and it could be from infection, it could be from a buildup of stones, or it could be structurally damaged, right? Majority of times it's going to be because of stones. Now, how do you know if you have gallstones? Let me tell you, you're going to know if you've got gallstones and pain. It's going to be pain in the epigastric region. So where your ribs come in, it's going to be right there, right in the middle. And it's going to hurt, and it's going to hurt predominantly after you eat something that is fatty. So if you eat some bacon and you're like, oh, I hurt, right? That could be, it could be your gallbladder saying, don't like that. I don't have enough squeezy. I'm getting blocked here. But if you get it after you eat everything, and it's not always got high fat content, then it might be something else. But it's a good idea to have a food diary, so that if you got pain and you got pain in that region, or it doesn't move from that region, every time that you eat something, write it down for a few days, then go to the doctor armed with the information. It's going to save you so much time and money, and you're going to get treated quicker. Okay, so how do they treat it? Well, they're going to remove it. And this is called a cholecystectomy. Okay, this can be done laparoscopically, which means they're going to go in with keyhole surgery and remove it. Or they could do a laparotomy, which is whereby they're going to make a small incision and they'll go in and find the gallbladder and remove it. So my mother doesn't have a gallbladder. Hers was removed because she was producing gravel, not stones, gravel, and it would build up enough pressure and then squeeze out. And oh, poor lady, she went 10 years undiagnosed for this. But this was back a while, like in the 80s, when this was happening. And they didn't have quite the understanding of it as they do now. She was in the hospital for a week, and they made an incision that was about yay big, and that was really revolutionary. It used to be a much bigger incision, and she was in the hospital for a week. Well, a couple years ago, we had a much older friend of ours that had her gallbladder removed, and they went in laparoscopically. She was out the same day, that afternoon. They did the surgery in the morning, and that afternoon she was out, and a few days later she was on a plane and she was climbing Machu Picchu. I mean, medicine is amazing, and it's continually evolving, right? Amazing. Now, I don't have a gallbladder either, because mine decided to stop functioning due to a structural issue. Now, because my mother's produced gallstones, and because my husband gets kidney stones, my children are at a high risk of developing stones in their body. So they're very cautious, or I am for them right now, about what they eat and put in their body, to make sure that, they have it in the back of their heads that this is something that could happen. I have a higher predisposition because I have a blood relative that causes stone formation to occur. So if you have a family member, a parent or sibling that has had cholecystitis, producing stones in the gallbladder, or even kidney stones, just realize that, because it's really worthwhile thinking, do I want to go through that and pain? Okay, I don't have one, and so neither does my mum. We know of a number of people that don't have a gallbladder. Yes, you can live perfectly fine without a gallbladder. It does, however, influence your functionality of your gut health, and it does mean that you can't eat anything fatty. Well, that's fine by me, right? I don't eat fat. Fat's not necessarily so good for me. Like, I wouldn't eat double bacon cheeseburger. That would be very bad. But an avocado would be fine, right? So nutritional, natural fats, not processed fats. Okay. Last thing about this, remember that we're making this gallbladder to concentrate up the bile. Well, it's got to come out, so it goes out of the cystic duct and it joins the common bile duct to break down whatever you're eating that needs breaking down with this high amount of fat concentration in the duodenum. Question number 5. What condition could you get if you drank excessive alcohol for too long? Cirrhosis of the liver, that would be a big one. But it could also cause lots of other issues as well. But cirrhosis of the liver was the main one that we were going for. Okay, here we go. The pancreas. The pancreas is only about 6 inches long and is less than 2 inches wide. It's quite narrow. It's kind of like tear-shaped with an extra lobule. Right? It is a retroperitoneal organ, meaning it is sitting behind another organ. In fact, it sits behind the stomach. The stomach kind of flops over the top of it, right? Retroperitoneal, behind another organ in the peritoneal cavity. Ooh, one of my favorite words. And we talked about this as well. Not only that it was a favorite word, but also like kidneys, they're retroperitoneal. Okay. Now, here's the important thing about the pancreas. It has 2 main functions. It is both endocrine and exocrine. Endocrine meaning that it is producing hormones, like in the endocrine system, right? Hormones. And these are going to be insulin and glucagon. Now, these are going to help regulate the sugar and getting the sugar into the cells. So the insulin says, come on, sugar in the cell. And if you don't have enough insulin, it could be because your beta cells, which create the insulin, found in clusters called the islets of Langerhans, are not working. And if that's the case, then you've got all of this sugar that's floating around in the blood. And it's like, where are we going to go? Can I get in the cell? And there's nothing to tell it where to go. And so it sits there. And unfortunately, it can damage blood vessels. It can damage nerves. It can even damage your eyes and retina and cause blindness. So having too much sugar in your blood supply is a very bad thing. Okay, so we need insulin and we need it at the right level. But that's the endocrine function of the pancreas. But it also has exocrine functions. So it produces pancreatic enzymes. This pancreatic juice is going to go down the pancreatic duct into the common bile duct in order to help digest the chyme that is now in the duodenum. And there are specific ones like carbohydrases that are going to break down carbohydrates, lipases that break down lipids, fats, nucleases that help to break down the nucleic acid that you can then use the resources to build your own, and proteolytic enzymes. These help to break down the proteins into their monomers of amino acids. Question number 6. What disease is on the rise and easily preventable with a change in lifestyle? Ooh. One of those was obviously going to be diabetes. Other things could have been cirrhosis of the liver, stopping drinking alcohol or doing drugs or all of that. There's a whole host of things that could be influenced by lifestyle changes. Okay. So diabetes, let's talk about this. You cannot live without your pancreas because you need it particularly for this insulin production, but you also need it for all of these pancreatic enzymes. You need it to function, otherwise you're not going to absorb the right amount of nutrients. But let's talk about diabetes. Do you realize that there are 2 types, type 1 and type 2? In type 1 diabetes, this is an autoimmune disorder where the body attacks those islets of Langerhans and beta cells and says, you're foreign, attack, destroy. Like as if you got a splinter into your finger and your body's like, destroy, it's not right, get rid of it. Well, unfortunately, it's what you need and your body doesn't realize it and it attacks itself and it's just like, ho hum, where is my insulin? It's being destroyed. There is also type 2 diabetes. This is actually the most common type, and this is where the pancreas has been producing so much insulin because there has been such a high consumption of sugar that it's like waving the white flag, going, I surrender, I can't make any more, no more, and it just gives up. Ruh-roh. Yes, big ruh-roh. So, amazingly, the majority, you can see in the graphic and this statistic here, the majority of cases of diabetes is type 2. Quite often they're going to be preventable by diet and exercise and lifestyle changes. A huge number of people have diabetes. 11%, almost 11.5%, almost 12% rather, of the US population have diabetes. That's a lot. And there's a lot that are undiagnosed. 22.8% of the adults are undiagnosed. So it's just guesstimated. And then there's pre-diabetes, which is basically going to be you're on the precursor. If you don't do anything about it, you're going to end up with diabetes and your pancreas is going to wave the white flag and say, I surrender. And look how many people that is. 97.6 million people. That's a lot. 38% of the world in the adult in the US, not the world, in the US only. That's crazy numbers. And again, majority of that could be affected by change of diet. We'll come to pancreatitis in a second. Diet. Okay, we've talked about this. This is the consumption of food and nutrition. Sugar, highly addictive substance, most addictive substance, and unregulated. Sugar is in everything. So it's not like people are going around with a spoon and a bowl of sugar and eating sugar. You don't realize where the sugar is. It's hidden in things like ketchup. It's hidden in your bread. It's hidden in simple sugars. Yes, obviously candy, but sugar is everywhere. We need some of it, we've talked about, but we don't need it in the refined, and we don't need it in the way that we're consuming it on huge levels. Okay. Let's talk about the last ailment I'm going to talk about for the pancreas, and that's pancreatitis. Obviously, this is going to be an inflammation of the pancreas. Now, this could become an acute or a chronic condition. So it could be acute because you have an infection or you have something, a gallstone, that is now causing you to have a backup of the enzymes that are meant to be breaking down the food, and it can't get out because there's a stone blocking the way in the common bile duct, and it now backs up. And so what is it going to digest? You, and you're going to get a very, very painful pancreas. Pancreatitis is agony. I have had pancreatitis after a surgery, and it kind of inflamed my pancreas, and it was in so much pain. They had to admit me and hospitalize me and give me serious pain medication because it was agony. It was really, really painful. Thankfully, mine was acute, which means it was very short-lived. Sadly, it was acute because it was really painful. But it could be something that you could have that's chronic. Now, chronic pancreatitis can be caused by alcoholism. Basically, you're going to denature your own pancreas and it stops working properly. Well, that can be problematic. Or it could be from chronic gallstones. So unfortunately, my poor mum, she has chronic pancreatitis. So she constantly lives with poor pain because the gallstones had, for 10 years undiagnosed, caused this backup into her pancreas of pancreatic fluid. And now her pancreas is always grumbling and being very painful. That was my impression of a pancreas. Did you like it? Okay, let's go back. So we had those 3 accessory organs. We had the liver, the gallbladder, and the pancreas, and they dumped into the common bile duct, which went into the duodenum. Now we have the other 2 portions, which are the jejunum and then the ileum. Excuse me, frog in my throat. Ribbit. Now, the third portion of the ileum connects to the large intestine, and that is going to be an important part we'll talk about in a moment. Okay, so remember, duodenum, jejunum, ileum. Okay. Inside the small intestine are finger-like projections called villi. They are there to help increase the surface area to suck up all of the nutrients. Okay, I wanted to do this. Put your hand out like a fist, okay? Now you're going to put your hand on one side and trace your surface. That didn't take very long, did it? Now put your fingers up again and we'll do it again. Ready? That took many more right? Because there was greater surface area for me to be able to, right? To run my finger over. That's the same thing inside your villi. These finger-like projections, right, the villi inside your small intestine, the villi inside your small intestine are there to increase the surface area to suck up the nutrients. And yes, there has to be sound effects. So when you are doing this, go because it's the villi that are sucking up the nutrients. Okay. You've got to put sound effects in. Now, one disorder that you are probably familiar with or you've heard about is celiac disease. Now, celiac disease is an autoimmune disorder that is triggered by gluten. Now, gluten is a protein that is found in certain products like wheat or barley or malt. And this, when a person with celiac disease ingests, let's say, wheat, they react to it really strongly. And they then attack these poor villi. That's what they sound like internally. You can hear them crying. You can't really, but you can think about it, right? So they meow. And now these poor little villi, like, surface area is gone. You can get malabsorption if you have celiac disease and you don't have these villi, as you can see right here. So again, these villi, you can see it beautifully, right? They're all extended, but if they have gluten, they become very short and not there to be able to absorb. That's a problem. The picture on the far side, that is in the purple. They're actually real slides of a person's small intestine with and without celiac disease. Obviously, without being a normal is the top one. You can see how beautifully finger-like they are, and the bottom you can see how stubby they are. So yes, there is actually a difference between gluten intolerance and celiac disease. So gluten intolerance basically means that you are going to have a symptom if you eat gluten, but if you had the celiac disease, you would actually have an autoimmune response and damage the small intestine. So there you have the symptoms of celiac, but you don't have the actual autoimmune response that damages those villi. So there is a difference. The same treatment, whether you're celiac or gluten intolerant, don't eat gluten. So where is gluten found? You remember your brow, right? It is in barley, rye, oats, and wheat, and any of the products that are made with that, such as couscous or semolina or, I don't know, farro, right? They're all hidden, and gluten is in those. So what does that mean that you can't eat? Well, you couldn't have beer because that is barley. You couldn't have pizza unless it is a cauliflower crust, right? You couldn't have rye bread. And some oats are actually made gluten-free, but you have to make sure that it's on the label. There is all sorts of things, right? So you have to be careful with what you eat. Which brings me to food allergies versus intolerances. Okay, so there is a difference between the two, between an intolerance and an allergy. Okay, so in an intolerance, you lack an enzyme to properly break down the food. But in an allergy, your immune system goes, attack! It's wrong! It's threatening! And you have this immune system response, an allergic response. Okay. With the intolerance, You can get digestive discomfort, like you could get gas and bloating and cramps, and you can have an upset stomach with nausea and diarrhea and headaches. But with an allergy, a true allergy, you might get things like itching and hives and swelling. Your throat might close up. You might have respiratory damage. You might have trouble breathing. Or you could go into anaphylaxis, which is a life-threatening emergency where everything swells up. You can't breathe, and it is a big problem. Using an EpiPen to counteract this would be an important thing, and seeking medical help. The allergy and allergic response could and usually is immediate. However, it can actually be a delayed onset. So you have to just keep that in mind. Like if all of a sudden you're having this massive hives breakout, well, what did you eat? Could that have been something to trigger it? Okay. Things that are versus intolerance versus allergy. Things that are in an intolerance would be lactose. You've heard of lactose intolerance. Well, lactose is the sugar that is found in milk, and some people just don't have the enzyme to break it down, and it causes them to have tummy troubles, right? Gluten could be an intolerance. Sulfites, these are found as additives into your foods, especially refined food or preserved foods. And FODMAPs, these are short-chained carbohydrates that are broken down further along in the small intestine that aren't broken down very well, and they cause inflammation of the intestinal lining and a response. Whereas an allergy, these are going to be things that are more prevalent in, say, tree nuts like walnuts and cashews and almonds and hazelnuts and pistachios and whatever the things that I can't eat. I'm very allergic to nuts. It could also be peanuts. That's another big one. Please note that a peanut is not the same thing as a tree nut. Milk, some people are allergic to milk, and that is different than lactose, and it's different than being lactose intolerant. Eggs, fish, shellfish like shrimp and lobster, soy, wheat, yes, there can be people that have a significant food allergy to these substances. Now, please note that there is a difference between a food allergy and a food intolerance because of the immune response. But there is also something called a food sensitivity. This is less severe, often not life-threatening, but there is a small immune response, and it involves a different form of their immune response with the IgG, not an IgE. And there is a difference between the way the body is responding to what is being given to it. In either case, the best thing you can do is avoid any food that is going to cause you intolerance, insensitivity, or an allergy. Most prominent, these are the most common ones in the US, being intolerant to dairy, gluten, cabbage, it makes you have the farts, or beans, again, make you have the farts, good, lots of gas. But peanuts and tree nuts and soy, these are really quite prevalent, and shellfish, very prevalent if you are an allergy sufferer. Quite crazy, 6.1 million Americans have a peanut allergy, 3.9 million have a tree nut allergy, and roughly 1 in 50 kids have this. And I see it over the years, and so has our nurses, that the number of people that have food allergies, severe food allergies, is increasing year by year by year. Lactose intolerance affects about 30 to 50 million Americans. Whoa, that's a lot. Okay, I have a gluten intolerance. Which of the following can I consume? Can I have a Budweiser beer because I'm of age? Not that I drink, but there we go. I could. I could have a pizza. I could have sorbet, fruit sorbet, or I could have a donut. Which one can I consume? Well, I hope you said the sorbet, and only in small amounts, because that is just basically fruit and natural sugars. But the others contain wheat products. So the beer made from a gluten source, barley. The pizza made from wheat, and the donut made from wheat. And all of those three choices also are high in fat or sugars, and generally should be consumed on a moderation, not often situation, right? Every once in a while is fine if you're not allergic or have an intolerance to it. For me, I can't have them, and that's okay. I don't miss them. All right, so let's talk about the large intestine. The large intestine is going to start when the ileum connects to it at the cecum. Now, attached to the cecum is a dead end called the appendix. Now, it was thought that this was a vestigial structure, meaning that you did not need it and that it was a-okay to remove. And we didn't know what it was there for. We thought that it was a remnant, a leftover from evolutionary ancestry past. We thought that it was there because in the days of old, we used to eat a lot more cellulose, and so it would hold the bacteria for the cellulose to break down the nutrients and the plant material, right? Because we can't digest cellulose ourselves, we need bacteria to do it. Well, we have since realized that the appendix does actually serve quite a function. It is our gut flora reservoir. Now, our gut flora are our good bacteria that we need to help break down not only cellulose, but all our nutrients and to provide us with good gut health. Really important. So, the appendix, it acts as a reservoir. It holds a number of our good bacteria, so that if you have a big bout of diarrhea and you flush out your gut bacteria, the appendix can help to recolonize your intestines. But sometimes it can go wrong. Remember, we said that you can get appendicitis, the most common age between 8 and 21, and you get pain in the lower right-hand quadrant, moving up to your belly button and your back, general feeling of unwellness, malaise, feel nauseated, lose your appetite, little fever, appendicitis. We don't know why it happens for some people and why it doesn't for most, but when it does, it's very dangerous and you need to make sure you get it taken care of. Okay, you don't want it to rupture and burst, because then that's peritonitis, which can lead to septicemia and death. Not fun. Okay, so appendicitis, we've talked about it before, and I've got a question for you. If I suspect that I or a loved one has appendicitis, what should I do? Go to the emergency room after contacting your doctor, unless it's outside of hours, and go and get emergency help, because if you go to the urgent care, they're still going to send you to the emergency room, so save yourself a copay. Remember, we talked about this before. Haha. So, pain in my lower right-hand quadrant, appendicitis. You can live without your appendix. That's fine. I do not have an appendix. My husband doesn't have an appendix. My mother doesn't have an appendix. It just means that if you do have a bout of diarrhea, that you are more likely to take a little longer to feel better, because you don't have that gut reservoir. But let's go talking to our large intestine, the rest of it. So, the ileum, the small intestine, connects to the cecum, and then we have the little appendix, right? The cecum then goes up, and it goes up on the right-hand side of your body, and it goes up the ascending colon. Then it is going to turn at the hepatic flexure, yes, which it means it's by the liver, right? So it goes and it turns and it goes across, and that's the transverse colon. And then it turns at the splenic flexure. That means it turns by the spleen, and it goes down the descending colon, and then it gives a wiggle, and that wiggles the sigmoid colon, and then it goes to the rectum. Now, the rectum is only about 5 inches long, about 12 centimeters, and this rectum's job is therefore storage of poop, to basically tell you, hey, you need to poop. There's enough poop in here that says you need to go defecate somewhere, and so it tells your brain to go do so. And that now involves your anus. Your anus is a double sphincter. So there are 2 internal sphincters and 2 external sphincters. So when you actually need to go to the toilet and do a poop, you're going to send signals from your brain to your anus to relax the sphincters, and with again peristalsis, chung 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 chung, the peristalsis is going to move the contents along and push it out the anus, and your abdominal muscles are also going to be involved, pushing out the poop into the toilet, and then once finished, those anus sphincters are going to close back up again. Okay, a condition with your anus could be, and rectum could be, hemorrhoids. Now, hemorrhoids are whereby you've pushed and strained for too long and you've pushed out a blood vessel that is either going to be in your rectum, or it can actually hang out of the anus and sit outside and become irritated. Now, this hemorrhoid can be as a direct result from pregnancy. Sorry, ladies. But yes, it can be from pregnancy, not only from carrying this extra weight, but also from when we push out a baby. We use the same muscles and the same thing to push out a baby as we do to push out a poop. And so it's quite likely that you are going to push out part of your blood vessels and you can end up with hemorrhoids. Heavy lifting, prolonged sitting. So I do hope that you're taking breaks every once in a while and going and having a little walk around in the sunshine, taking nice deep breaths and relaxing and moving your brain around by looking 20, looking at 20 feet away every 20 minutes for 20 seconds, help your eyeballs, but also taking a break so you're not putting all this pressure on your anus, which could cause hemorrhoids. Ouch. All right, so if you do have hemorrhoids, don't be embarrassed. Go and you can get some creams such as Preparation H, or you can use, I think there's something like rubbing alcohol or something, not rubbing alcohol, witch hazel, that's the one. Oh, don't put rubbing alcohol on it. That can help to strengthen up the anal tissues. Again, if you're having issues, speak to a doctor. Make sure that you are being treated. Don't just treat yourself. Going to CVS, you could talk to a pharmacist. They might be able to help you. And if they're really, really bad, they could be surgically excised, meaning they're going to be cut off and surgical. But to help prevent this, eat food with lots of fiber, lots of water, and make sure that you're not sitting on a toilet straining too much. So constipation is a number one cause of this. So obesity, constipation, pregnancy, heavy lifting, that can also cause increased risk of that. So make sure that you're looking into keeping your intestines healthy for all sorts of reasons. And one of them is to prevent hemorrhoids. Speaking of heavy lifting, you could get a hernia. Hernias are whereby you can have your intestine that protrudes through the abdominal wall, as in these pictures, and you get these little lumps. They're not good because what can happen is they can become strangulated and they can get their blood flow cut off, and they can inflame, get bigger, and burst or die and cause issues. So if you do all of a sudden get this protrusion from somewhere in your abdomen, please get it checked out. It is more likely for a gentleman to have one that descends down the inguinal region, that's in the groin, because of the testicles that descended through the inguinal channel when you were growing and developing as a fetus and an embryo as a baby, right? So it is likely that they could move down into the scrotum. Again, not so good, needs to be fixed. Women tend to get a little outie of a belly button, not always really bad, nothing to do with hernias when they're pregnant, but there is a case whereby you can have weakness in your umbilical region and it could pop out. For example, my brother-in-law, he got bronchitis, really, really bad, a chest infection. And he was coughing, and he coughed so hard that pop, his belly button went from an innie to an outie, and he gave himself an umbilical hernia from coughing. Yes, it can happen. So he actually had to have surgery. They made a little incision at the bottom of his belly button, and they slipped the intestine back in, put some mesh in to prevent it from coming back out, and sewed it back up again. Voila! If you're very much into weightlifting and heavy lifting, be careful, because that can also increase your risk of getting a hernia. And I already talked to you about a hiatal hernia, which is the one that goes up through the diaphragm and it goes upwards. Oh, very cool. Okay, IBS. This is another umbrella term. It stands for irritable bowel syndrome, and there could be a whole lot that could be involved in IBS. It could be your bowels are irritated, so you can get cramps and diarrhea and gas and constipation, or it could also be to do with a imbalance in your gut microbiome, so the gut flora, the bacteria that's in there. SIBO, that's small intestinal bacterial overgrowth. So you've got a dysbiosis of bacteria that are in your intestine causing issues. Or it could be things like ulcerative colitis or Crohn's disease. These all come under the domain of IBS. There is a difference between IBS and IBD. So IBD is irritable bowel disease, which is more likely to contain the Crohn's and the colitis, right? And it is to do with an immune dysfunction, chronic inflammation, and the like, right? Whereas IBS, more of the syndrome rather than a disease, could be complicated with diarrhea or constipation or mixed, and that there is no observable, you can't see the inflammation or damage. If they did an endoscopy or colonoscopy, you can't see there being damage to the internal structures. Again, both are going to be treated with medications and lifestyle changes, but some of the medications may be even more aggressive if you have IBD versus IBS. Leaky gut syndrome. Now, this is actually relatively new. This is kind of on the cutting edge of understanding about what this is. So inside our intestines we have cells that are smudged together, and they form a nice barrier and junction. They're like all linked up together, and they cause it so it's a nice barrier to the food from getting into the blood supply, unless it is needed and wanted and made to the right state. Unfortunately, when we have leaky gut, this could be where their junctions are no longer tight, so there's space between the cells, and or there is inflammation, or there is a hormonal change that is causing these cells to have space. And so this would allow for food particles, bacteria, viruses, toxins, waste products, and undigested food to slip through the cracks and get into our bloodstream, which then causes inflammation, immune response system, increased allergies, all sorts of issues. And we're noticing that there is a lot of triggers that can cause this, such as antibiotics, stress, continued allergies, toxins, menopause. Not much you can do about that when you get to menopause age as a female, and dietary influence, okay? Stress, very important, because again, it changes the hormones, which can change your leaky gut. And this leaky gut doesn't just stay in your gut, but it can cause you to get sinus infections. It can cause you to have adrenal fatigue. So your cortisone levels or cortisol levels are going to be out of whack with your DHEA, which are your energy reserve levels. It can cause ADHD, attention deficit hyperactivity disorder. So what you eat can actually influence how your brain functions. You can get brain fog. It can affect your acne in your skin. You can get psoriasis and eczema. It can cause constipation. You can get sore joints. You can get amazing. All from your intestines. It can cause all of these issues, because you're having all of these other inflammatory and immune responses. Whoa. Okay, question. Are leaky gut, IBS, pancreatitis, and hepatitis preventable? Hmm. Yes is the answer. Predominantly, yes. That you can prevent it by having a good diet, good lifestyle, healthy choices, highly nutritious, lowering your stress, exercise, all of this to make sure that you're having good bacteria, good healthy body, and it can help prevent that. Obviously, alcohol, smoking, very big no. And yeah, obviously, heck no to drugs, right? But all of this could influence poor diet choices, high fat foods, high cholesterol. All of that's going to cause issues. So, yes, preventable to an extent. There we go. Digestive doctors. Who are you going to see? Not anybody just on the street, like, can you fix it? But you're going to go to a specific doctor, and that is going to be like a gastroenterologist or a gastrologist, right? Registered dietitians, they can help you with your diet. A hepatologist, remember that's going to be your liver. A proctologist, they can help with your prostate gland and with your anus. And prostate gland is in men, not women, but they deal with that region down there. A dentist and an orthodontist. Why? Because you've got to keep your teeth in good working order, because that's where we start with the mastication and the chewing. And an endocrinologist. Why? Because think about your pancreas, right? That produces the hormones. It's both an endocrine and an exocrine organ. And an endocrinologist can also help with fixing your hormones if they're out of balance and causing leaky gut. Whoa. So sometimes you might need to go one step further and have an exploratory procedure. This one here that you're picturing is an endoscopy. This is where they go down the top end and they are going to put you asleep. You're in a twilight zone and you lay on your side. They put a little mouth guard in so that you don't bite the probe or yourself, and then you're knocked out asleep, and then they shove this camera down your throat and they're looking to see what's going on. They can go down through the duodenum with this particular scope, and this is an endoscopy. It's really easy. It's a real simple procedure. I cannot tell you how many I've had. I've lost count, but they're pretty impressive. They can see a lot of things about your stomach, your throat, your duodenum, the small intestine. They can even thread down little biopsy tools to take sections out to test to see if you have celiacs or inflammation or whatever it might be. Very, very cool. And again, you wake up and like nothing's happened and you're good to go. The same day, within an hour of waking up from the anesthesia. They just want to make sure you're okay from the anesthesia. Now, the other end is a colonoscopy, and this is where they put a camera, a different one than the endoscopy, up your rectum and through your sigmoid, through the descending, through the transverse, and down the ascending colon towards your appendix. And this is where they can have a look at the large intestine. Now, ladies and gentlemen, at the age of 45, you are going to get your first colonoscopy and then repeat it every 5 years or so. Now, if you're African American, there is a higher risk factor for colorectal cancers, and so they recommend getting your first one at 40. They also recommend, this is from the American Cancer Society, that if you have a close family member that has or had colorectal cancers, that you start getting your first colonoscopy 10 years before their first initial diagnosis to make sure that you're A-okay. And that if you have polyps or growths or anything that they've taken biopsies, you'll be more frequent than the every 5 years or so. The worst thing about this is the prep. You have to empty your bowels, which means that you're going to either swallow a pill or drink some really disgusting prep liquid. You can tell I've had these before. They're disgusting. And you are going to poop and poop lots until your poop is clear liquid and there's nothing left inside you, so that they can place the camera up and have a look, because if it's full of poop, they're not going to be able to see anything other than poop. So the colonoscopies at age 45, you're going to start doing these, and again, early detection is key for health, to make sure that you're all good to go. Speaking of poop, I get to tell you the nicest things, don't I? I'm so lucky. So poop, yes, your colour is going to tell you a lot about your health. There's going to be colour and shape and frequency, and they all tell you a lot about your health. Even the smell of your poop can be indicative of your health. They actually have dogs that are trained to sniff out colorectal cancer. So they come along and smell your poop, and if they alert to it, they can actually detect that you've got cancer cells starting in your poop. How cool is that? All right, let's go back to color. Yes, your poop should be brown. If it is red, don't panic. I want you to think, did I eat beets? Did I have red food dye? Because if you did, it can change the color of your poop. If not, and it is blood, don't panic. I want you to ascertain where it is coming from. If you've got a little rip or a little hemorrhoid, it should clear up, keep it clean, blah, 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 blah. But if you're dripping blood from your anus, this is a call to the doctor and tell them, hey, I need some help here. They may send you to the emergency room or urgent care to get treatment in case you've torn a little bit of your rectum or something. Okay, likelihood of this happening? Very slim. But I'm going to tell you about it anyway because I think it's fascinating. All right, if your poop is mustard yellow or clay colour or even white and mucousy, or if it is this mustard yellow but floating and oily, you might have a problem with your pancreas and or your gallbladder or your liver, your 3 accessory organs. Again, if this is just a one-time thing, all of a sudden you've done a poop and it is oily, floaty and a bit yellowy, but the next one's fine, maybe you ate a little bit too much fat. Alcohol can also change your poop colour. Okay. So just keep an idea about what does your poop usually look like, and anything that's different from the usual, then you make a note of. And if it lasts for a while and you're having other symptoms, that's worthwhile talking to the doctor about. All right, if your poop is green, are you eating lots of spinach or leafy green vegetables, or are you taking an iron supplement? Because again, that can change your color of your poop. The one that you want to be really concerned about is if your poop is black, because if your poop is black and tarry looking, it is likely that you have an intestinal bleed somewhere higher up, not closer to your rectum or anus. And this definitely warrants going to the doctors and saying, hey, I've had some black tarry stool for the last couple of days. You probably want to make sure that that is a phone call to the doctors ASAP. Okay, cool. But I say black and tarry, except for if you are a baby. Now, babies, their first poop is called meconium, and it is black and sticky. Then afterwards, their poop changes depending upon if they're breastfed or if they are bottle fed. If they are breastfed, it is going to be bright mustard yellow and seedy. But if they are bottle fed, it is going to be harder in consistency. Breastfed babies, they have more poop. It goes everywhere and in every direction, and you get covered yourself. Anyway, I digress. We'll talk about that later. And they could go more often, whereas a bottle fed baby, they're more once a day eventually, and it's going to be a bigger, more thick consistency, and usually more smelly. Ew. I get to continue talking about poop now. I'm going to talk about poop shape. Your poop should be a well-formed sausage J-shaped log, and it should come out easily without too much straining, and you should feel like you have emptied your bowels completely and you have no more poo in you. You shouldn't be sat there on the toilet for half an hour, 45 minutes, waiting for the poop to come out. Now, there's a different thing if you're sitting there and you're reading a book or something and you just got into your book. That's not. If you're sitting there waiting for your poop to come out for that long a period of time and you're straining for a long time, go see a doctor. Okay. If your poop comes out as lumpy, hard boulders or pebbles, again, that could lead to constipation as showing and not so good. It can be very harmful for your body, and so you want to make sure that you are having nice, well-formed shaped logs. If you are having constipation and your poop is really hard, increase the fiber that your content and increase the water. And if it continues, then seek medical attention. And the same if you are having very loose watery stools, diarrhea. This could be a problem if you're continually having this. Obviously, if you've got gastroenteritis, you've got a stomach bug, or you've eaten bad food and your body is doing the natural, like, let's get rid of it, that's okay. But if it's lasting for a number of days, that's not okay. And again, seek medical treatment. Again, your poop can tell you a lot about your health. So can the frequency of which you're pooping. Some people go every day. Some people go twice a day. Some people go every other day, every 2 days, every 3 days. The frequency is not as worrisome as the shape of it and the color of it. So in some people, if it is a regular, this is your normal, you go every second day and you're pooping, okay, that might be the way that your guts work. But if you're sitting on the toilet for half an hour and straining and straining and straining and still not going, that's not a normal thing. But if you're going every time you eat and again, that's not a normal thing, and you should be seeking medical attention just to make sure that everything is a-okay with you. And what's in poop? Well, it's important to know that poop majoritively is water, which is why you need to make sure that you drink enough water. And that it contains bacterial biomass, so bacterial cells, and undigested fiber, undigested food, and dead you cells. So cells that made up your stomach lining and gut lining and just you. That's going to be the main part of poop. Okay, we're getting there. You can do this. I can do this. Make sure if you need to take a break, you're taking a break and you're looking every 20 minutes, 20 feet away. Give your eyes a break for 20 seconds. Don't sit for too long. You might get hemorrhoids, and that you're stretching. But let's talk about this because I think this is fascinating. So inside your intestines, you have bacteria. Now, these bacteria, there is a huge connection between your gut brain. So your gut and your brain, you have a direct hotline between each due to this bacteria. We're finding out more and more evidence that the bacteria that's in our intestine is super important for our own mental health, for our physical health, for all sorts of things. And it's the right balance of the right bacteria. So if you have harmful bacteria like Clostridium difficile, that C. diff, that gets out of control and it grows. There's only so much space. If it's filled up too much with the nasty bacteria, then the good bacteria gets squished away and the bad bacteria becomes too prevalent. The bad bacteria can cause problems by toxicity, by reducing the good bacteria in their benefit, and not good. Okay. So, there are cases whereby when the bacteria gets out of balance, that it can cause symptoms. So, there is a story that is told because... Well, it's pretty awesome. And two, it's told all over the place because it happens more often than you think. Okay. Then I was told this when I was in college, that there was a lady who had been really sick. And she was an elderly lady, and she had gone into the hospital because she had this nasty infection in her leg, and they put her on some IV antibiotics, and the infection after a few days went away, but she got sick, like really sick, sicker than she was when she came in. And the husband sitting by her bedside saying, "Doctor, what can we do? My wife, I've been with her for 40 years. I can't lose her. What can we do?" And the doctor says, "Well, we can try something here, and gave him a pan and said, poop in this. What? Okay. So the husband pooped in the pan and gave the poo back to the doctor, who put it in a blender with some water or saline solution, blended it all up, and then put the poo water into the wife with an enema. So put a tube in her rectum and poured the poo water down a funnel, down the tube, and into the wife's large intestine. And the wife got better. Why? Well, it was because the bacteria from the husband helped to recolonize the bacteria that was missing in the wife from the antibiotics. Because remember, antibiotics don't destroy just the bad bacteria that's causing you the infection. It destroys all the bacteria in your body and on your body. And so when she had the IV antibiotics, it destroyed all of her intestinal and gut bacteria. And so now the husband, because they'd lived together for 40 years, they shared a lot of similar bacteria. And so he was able to recolonize her intestines with the bacteria that was still left in his poop. Amazing. Now, this actually is becoming researched heavily now, and it is called an FMT, fecal microbiota transplant, also known as a stool transplant or bacteria therapy. This is whereby they take healthy poo from a healthy individual and they are going to put it into a person whose bacteria growth is dysbiosis. It is out of control, particularly with this C. diff bacterium that has become overgrown in the intestine. This is currently the only one that the FDA has officially said is useful for an FMT, because your C. diff is out of whack, and this bacteria helps, fecal transplants help to replace and boot out the bad bacteria, especially if this bacteria is not responding to antibiotics. Now, there are people that want to try this at home, and there are lots of instructions on how to do fecal transplants DIY method. No, because you don't know what's going on with that person. In fact, there was a lady who was professing the wisdom of having a fecal transplant and made her, I think it was her boyfriend, took his poop and scooped it into empty capsules and then froze them and ate the poo capsules. Yes, it literally had poo in it. And then she actually started getting depressive symptoms because her boyfriend had diagnosed depression. And it thought that, well, she couldn't keep taking that. So she then used her brother's poop. And he was diabetic and had issues, and it caused her to have issues. I mean, it was crazy. So again, don't do it yourself, because one, that's weird, and two, it's not processed properly. What they do is they actually do a lot of screening with this fecal microbiota transplantation. They take the individual, they do a big interview interrogation to look at their lifestyle, and then they test the poop for infections and bacteria that you don't want, and all sorts of other things. And once they've finally processed it, and they've done it through the screening process, and they've processed it through their machines, then they're either going to make it into pills, or they'll do it as an enema, which is the part that goes up your bottom with a hose pipe and puts that material in, and then you get better. And they're actually using this. Kind of crazy, right? They're actually doing lots of research on this, because they found that the fecal transplants are an amazing way of reducing symptoms and cravings for addictions like alcohol and even sugar. So people who are diabetic and crave sugar, they take a fecal transplant from somebody who doesn't have any desire to eat much sugar, and it reduces their cravings and they get better. It's like, whoa. And the same thing for alcoholics, is they found that having fecal transplant from non-alcoholics, from people that just don't care for drinking, actually causes the alcoholics to not want to drink anymore. What? So this is the forefront of research right now, and this is what they're looking into to see if fecal transplants can affect alcoholism, addiction, diabetes, ulcerative colitis, and other things. Like, wow, if it was just poo, bacteria that can fix you. Well, that's my question is, would you be willing to receive FMT? Just a personal question, no right or wrong answer. I'm just curious. We're at the review stage, people. Hooray! I'm so excited. As you've probably been able to see, there is a lot that is within the digestive system, like a lot. And I didn't go through nearly half of it. Like, there is so much more to the digestive system. It is an incredible system, that is for sure. So, in general, to sum up, let's figure this out. What was it for? The whole thing is to intake food, to break it down so we can absorb and assimilate the molecules and the amino acids that you need and the vitamins and everything else that your body requires in order to be healthy, and similarly to eliminate anything that is left over and undigested and waste products. Hooray! And how does it do it? Well, complicatedly, right? Well, I say complicated, but in reality, it's kind of a simplistic design that we've got a tube that takes in the food. We're going to have mechanical and chemical breakdown all the way along. We're going to have muscles that move the food along the way. We're going to have more mechanical and chemical breakdown. And then we're going to do absorption. Now, the small intestine with its little villi absorb 90% of all of the nutrients from the small intestine. Really important place, right? 90% of all the nutrients and water comes in from the small intestine. So what is the main point? Main point of the large intestine? It's not really for digestion, but rather for reabsorption of water and for the formation of poop. So if you eat a diet all of a sudden that is really high in fiber, and you've been living on McDonald's for a long time, and all of a sudden you have fruit juices and cleanses and don't do that, but anyway, if you've got high cellulose diet all of a sudden, you're going to find that the amount of fiber pushes along your food through the large intestine quicker than the water can be absorbed, and you might get diarrhea until your body becomes acclimated to the new fiber regime that you're putting in your body. But if all of a sudden you've gone from having a huge amount of fiber to McDonald's, which is limited fiber, you're going to find that it is sluggishly moving along your large intestine, and more water is being extracted, which is what causes you constipation. Oh, so there's a fiber and water balance here that's going to be very important for your poop formation, color, for removing the waste rather than it sitting in there and being reabsorbed with the toxins. Very important stuff going along, right? And there's lots of pieces that are involved in this, like your 3 accessory organs. Really important. And everything's kind of in balance with one another. And the other big thing is keeping your gut flora, those bacteria, really healthy. You want to make sure that they're maintained and made healthy. We talked not only anatomy and physiology, but we also talked about health and diseases. And there was a lot of diseases that I mentioned. Are there more? Yes. We didn't talk about obstructions or diverticulitis. I mentioned but didn't explain ulcerative colitis or Crohn's disease. Let's see, what else? Obviously, there's cancers throughout that you can get. We did a pretty good job, though, looking at this. We did a pretty good job. Well done, us. But there are many, many diseases. And the big thing is that you don't want any of them. And some of the ways that you can prevent them from occurring, obviously there's the genetic predisposition that you can't do anything about, but what you can do is keep your guts happy to keep you healthy. And to keep them happy, you're going to have a nice high fiber, you have complex carbohydrates, balanced nutritional input, exercise, water, because water's your friend, and water's your friend, we like that, thumbs up, and limited amounts of things that could cause you difficulties, such as refined sugars, such as high fats or refined fats and animal fat products that are high in cholesterol. If you keep if you're cognizant, that's the word I'm looking for, about your diet, what you're putting into your body, and you're thinking about exercise and you're just thinking, how can I make my body better? This can make it so that your body will look after you for many, many, many years to come, which is what you're wanting. Final question. What are the finger-like projections in the small intestine that are used to increase the surface area? You can tell it's been a long lecture. What are they called? They are called, obviously, the villi. I just had to do that again. All right, the villi. All right, up next, what do we have next? Okay, little walk, very important. A little snack break, good stuff. Make sure that your snack or your food or your lunch or whatever it might be that you're having is nutritionally and well balanced. Lots of water. We like water. Not excessive. A little exercise, a little sunshine. Good to go. And then come back and we'll do the comparative dissection of a sheep, horse, and human digestive system. It's massive. You're going to build your digestive system out of clay in your mannequin. Don't forget that you have an extra credit opportunity with forming a food bolus. Yum, 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 spit. Ooh. And then make sure you take your chicken wing out the freezer. This is going to be very important. Take your chicken wing out the freezer and put it in the refrigerator. Don't leave it on the counter. Put it in the refrigerator so that it has a chance to defrost for tomorrow. And then review how to dissect your chicken wing. And then obviously keep in mind healthy options for your body, like breathing, eating nutritionally, balanced meals, trying to reduce the amount of caffeine you have, being social, putting your phone away. Ooh, all sorts of things. Yum. All right, if you've got any questions, please let me know. But if you've made it this far and you're feeling good about yourself, and your notes are looking pretty, and you're just, I think you should pat yourself on the back. I think you've done a really good job. Well done. I'm proud of you. You've got this. You can keep going. I know it. Awesome. High five. Boop. Well done. I'm proud of you.